Hello, everyone. It's Paul again with New Jersey Recovery and Wellness. Thank you so much for staying with us as we continue to commemorate National Recovery Month by talking about how to support a person in your life who you know and love who has a substance use disorder or is in early recovery. Stay with us as we tune in to day 29 of our 30-part series. Check it out. Discuss medication-assisted treatment. When a person with a substance use disorder begins the process of healing and pursuing recovery, there are many things to consider, and we've talked about many of them during this series. Talking about people, places, and things, setting goals, seeking support with peers or mental health professionals, joining a recovery community, and creating other healthy lifestyle habits. We've also talked about the benefits of paying attention to our physical health through looking at our diet and getting a checkup with a doctor. We can also consider how medical intervention or pharmacotherapy can assist in the recovery process. How do you support a person in your life who has a substance use disorder? Discuss medication-assisted treatment. Medication-assisted treatment, abbreviated to MAT or MAT, is a set of pharmacological interventions that can be applied to the treatment of various substance use disorders as a part of a person's treatment plan. The prescribed medication can do many things. It can help to normalize brain chemistry, block the euphoric effects of some substances, relieve cravings, as well as restore some quality of life to the person with the substance use disorder. In the US, the Substance Use Mental Health Services Administration, or SAMHSA, has conducted research year over year tracking trends and effectiveness of various methods of treatment for substance use disorders. MAT has been shown to be clinically effective and significantly reduce rates of relapse or recurrence, therefore preventing the potential risk of overdose and death. Beyond this, there are many more benefits of MAT, including increased job retention, decreased criminal activity related to substance use, improved quality of life. Clients also stay connected with mental health services for much longer than without being on MAT. Key takeaway here is there is a reason for this particular type of treatment to be on the table when discussing a recovery plan with your loved one who has a substance use disorder. However, with all that being said, we do need to acknowledge that MAT has a bad rap. Some people just don't like taking medications, and the idea of needing to take something, whether it be a pill, an injection, or some other form of medication in order to help stay stable, can be very off-putting for a person. Some individuals can view MAT as replacing one drug for another. This just simply is not the case. For individuals that are misusing substances, these substances are not prescribed and they actually take away from quality of life. They're detrimental. Medication-assisted treatment, these instruments are prescribed by doctors and they have been researched over and over again showing that they do not take away from quality of life. They help a person regain quality of life. And beyond this, there are those who are in recovery circles who believe that taking any medication to support mental health or behavioral health is a sign of weakness, or that it's not true recovery. There's a lot of stigma against MAT. It makes it difficult for us to see it for what it truly is. It's another tool in our arsenal to treat this potentially life-threatening condition, addiction. So here's just a few pieces of information that may be helpful when considering if you want to have this discussion with your loved one, to see if it might help. MAT can be effective for several substance use disorders, yet not necessarily for all of them. We're going to specifically talk about how MAT is used for alcohol as well as opioids. When we're using medication-assisted treatment for alcohol use disorder, there's 3 primary medications that are worth noting here. The first is acamprosate, which also goes by another name, Campril. Acamprosate is typically used as a means to reduce urges and cravings attached to alcohol use. For an individual who has an alcohol use disorder, when they abruptly stop using and they try to maintain not using for a period of time, they may naturally experience some urges and cravings. With the use of this particular medication, the severity and the frequency of these occurrences may reduce. This can be helpful for a person who wants to stay on target with their goals for reduced alcohol use or abstinence. The next medication to note here is one called diasulfiram, otherwise known as Antabuse. This particular medication, when taken on a routine basis, can help a person abstain from alcohol use because they have the upfront knowledge that if they use alcohol while they are taking this medication, they are going to have some significant and severe physical distress. Just to call it what it is, a person is going to become extremely nauseated, usually are vomiting quite profusely, and feel ill for a couple of days if they do consume alcohol while on this medication. So routinely taking this medication can be a deterrent for a person. They do not want to consume alcohol out of fear that they are going to feel very, very ill. This medication can be helpful for some individuals because people don't like the idea of not feeling well. The third medication to consider here is one called naltrexone. Naltrexone is a medication that is an antagonist. What is an antagonist medication? This means that this medication is going to block the effects of the substance. So if I am taking an alcohol antagonist, it is going to block the receptors in my brain where alcohol binds. So that if I go to consume alcohol, I'm not going to experience the pleasurable or euphoric effects. I'm not going to feel buzzed. I'm not going to feel drunk. Now, this particular medication comes in 2 formulations. There's a pill, and then there's an injection. So for those that take the oral medication for naltrexone, they need to take this on a daily basis. Some people do really well with taking medications. Others may forget and they have a hard time staying consistent. This is where the other formulation, the injectable, comes in. Injectable naltrexone, which is also called Vivitrol, is used once monthly. You schedule an appointment with your doctor, a doctor who prescribes this particular medication. You get the injection and then come back 1 month later to get the next one. So you don't have to worry about taking a medication every single day. It's just a once monthly doctor's appointment. Not every doctor prescribes this medication. There's specific standards and trainings that physicians need to go through. So if this is something that you do want to consider, you'd want to research this ahead of time. Now we're going to address the medication-assisted treatments that go hand in hand for those who have opioid use disorders. The first we're going to talk about is a medication called buprenorphine. Other names for this particular medication are Suboxone or Subutex. Other formulations or brand names of this particular medication. Now, buprenorphine is a partial agonist. This means that part of the medication is going to be blocking effects while another part of the medication is going to be going into the receptor site. So the brain is in essence going to be tricked a little bit. Any urges or cravings to pursue use of the substance of choice, whatever that opioid is, some of that is going to be reduced. It's going to be soothed because buprenorphine is partially initiating that receptor. This can be a great adjunctive tool for someone's recovery, especially if a person has tried, in most cases, multiple times previously and unsuccessfully without the use of medication-assisted treatment. Another medication that has been used to treat opioid use disorder is something called methadone. Methadone has been around for quite a long period of time and is used and prescribed in a clinic type setting. Again, not every doctor can prescribe methadone. Methadone is typically viewed as a longer term treatment for an opioid use disorder, and it is an agonist medication. So this means that it is simply tricking the brain. We are replacing one substance with the other. However, this substance is not purchased off the streets. It is prescribed. It is FDA regulated. We know what is going into this substance, as opposed to if a person continues their substance use, there can be a lot of risk involved here. Individuals who are on methadone are typically going to this clinic type setting on a daily basis to receive their dose of medication. While yes, it is still having a substance routinely in the brain that is fully activating these receptor sites, an individual is able to resume pursuing their quality of life because they are not frequently and dependently seeking out the use of the illicit substances that they may have been using daily. Finally, we're going to talk about naltrexone again. Yes, naltrexone, which is what we just talked about when we were talking about medication-assisted treatments for alcohol use disorder, is also approved for opioid use disorders. And it does the same exact thing inside the brain. Now, the same formulations exist here. A person has the option of taking oral medication daily or having a once-a-month injection of naltrexone called Vivitrol. If your loved one with a substance use disorder does not have a specific issue with either alcohol or opioids, there is still a possibility that there may be some benefit from an adjunctive medication to assist with cravings or compulsions, even the mood fluctuations that can commonly occur in early recovery. And as a final note, and notedly a controversial note, there are researchers who are also studying the effects of marijuana and CBD to be used as harm reduction approaches to treating substance use disorders. In some states in the US, marijuana is also being prescribed medically for the treatment of opioid use disorders, technically classifying it as a form of MAT. As the political conversations surrounding marijuana continues, we'll likely be hearing more of this in the near future. Just the same way with any other progressive, potentially life-threatening condition, when we learn of the diagnosis and meet with our physicians or treatment teams, we're going to want to hear out all of the recommendations and take a look at the options. For those with substance use disorders, the case for MAT is strong, with plenty of research supporting its effectiveness. No one's going to be making any medical decisions for your loved one but themselves. We want to make sure that they have all of the appropriate information to make decisions for their behavioral health care so that they can have the best chances as they move forward in their recovery. Thank you once more for staying with us as we continue to commemorate National Recovery Month by talking about how to support a person in your life who you know and love who has a substance use disorder or is in early recovery. If you liked what you saw here, please do click that like and subscribe and ring the bell so you can get notifications for other videos in this series or other videos that we post on this channel in general. Please do share this information with anyone that you think could benefit from it. We here at New Jersey Recovery and Wellness appreciate you. Thank you so much. We'll catch you next time.